Carlos Icy with ESPN LA, and welcome back to the Road to Recovery. We are lucky to be joined by Dr. Alan Beyer, board certified orthopedic surgeon from the Hoag Orthopedic Institute. Dr. Beyer, how are you?
Very well, Carlo. How are you doing?
Doing great. Wanted to try something different here. We always talk about the injuries, and it kind of sounds a little bit of death, doom, and gloom. Let's lighten things up and talk about the rehab process and live up to our name, Road to Recovery.
I think that's a great idea. Let's get into it.
What's in common with these trending names, these three newsworthy names right now? Aaron Rodgers, who we've talked about before, Jalen Ramsey, a former Ram, and Bryce Harper.
Well, aside from the fact that they're three world-class athletes, obviously, I think there's a couple of things that our listeners need to keep in mind when they have similar injuries and are wondering why am I not getting better as fast as these guys are? I don't put as much strain on my body as these guys do. What's going on? Let's set a couple of parameters. First of all, and this is great advice for anybody having either an injury or even elective surgery. There's a few things that you can do prior to or at the time of your surgery that are going to help you get off on the right foot after the surgery is completed. One of those is lay off of smoking and drinking. If you have a couple of weeks before your surgery, cease your alcohol intake, cease your smoking. That's going to help your tissues heal better after your surgery. If it's an emergency surgery or a trauma like these athletes encountered, stop right then. I mean, it's never too late to stop, right? So get those things out of your system. Likewise, I think ceasing taking extra supplements and things at and around the time of your surgery and the few weeks afterwards can also confuse the picture. There's no magic supplement that makes your body heal faster, so don't keep searching for it. Let nature take its course, let the surgeon do his best job, and then you do your job after the surgery is completed. Finally, I think it's nutrition. I think that one thing that all of these athletes have going into their injuries and their surgery is that they're on a well balanced nutritional program. Every professional team in every league has a nutritionist. These guys aren't eating drive through fast food every other day and then recovering from surgery. So I think those four core points are important for anybody, whether they're a professional athlete or a weekend warrior. Then I think that the other thing that people have to keep in mind is that these guys' job, now that the surgery is completed, their 7 day a week, 24-hour a day job is recovering from their operation as quickly and as efficiently and as good an outcome as possible. So they are being worked on either themselves or by other professionals who care for them, the therapists, the trainers, everybody else, basically 24/7. These guys' job is to go to physical therapy, to do their exercise, to do the things that optimize their outcome. Most of us regular people have jobs that we have to go to after a surgery. And yes, we squeeze a physical therapy appointment in maybe 2 or 3 times a week to help us along, but that's not our full time commitment. We're not being paid just to get over that surgery. So I think that these are two phenomenally big differences between guys like you and me and guys who are making millions of dollars a year recovering from their surgeries. So that's an important thing for people to keep in mind and not hold themselves to a level of achievement that an Aaron Rodgers can, for instance.
If only we were millionaires. If only a double double from In and Out could cure a torn Achilles much faster than usual. If only. But let's go back to the injuries. We have Aaron Rodgers who's walking around throwing a football on the field, despite just having Achilles surgery. Jalen Ramsey, who injured his left meniscus July 27 in training camp, he's ready to take the field. And then Bryce Harper, who had Tommy John surgery, came back much faster than we've ever seen any baseball player come back from Tommy John surgery, and he's having one of the postseason runs of his career. Dr. Beyer, have you ever seen in the professional world or even in the normal world recoveries like this?
Well, first of all, Bryce Harper is the new Mr. October, right? I mean, there's no doubt about that. Let's start with him first, okay? Because he's out there now. They're in the throes of a playoff run. That game last night, 10-0. I mean, that's got to take the wind out of your opponent's sails when you win a playoff game 10-0. So, I mean, the Phillies are looking awful good. Um, Bryce Harper, again, when we discussed this when we talked about Shohei Ohtani a couple of weeks ago, Bryce Harper's a hitter, not a pitcher. The coming back to the hitting activity after a Tommy John procedure, which, by the way, is a more unusual injury in a hitter than in a pitcher. We don't read about a lot of non-pitching players sustaining ulnar collateral ligament injuries and needing Tommy John surgery. But coming back to the hitting motion after a Tommy John surgery is far less stressful on the elbow than throwing a baseball at 98 miles an hour is. So I don't think that Bryce Harper's recovery is really that unexpected. He's maybe a couple of weeks ahead of a couple of other guys who've come back to batting after Tommy John surgery. He's a phenomenal athlete. He's not gotten the credit that he's deserved over the years. Um, there were clubhouse issues in his former club. He's always been compared to Mike Trout, who's, one of the greatest. When you look at the body of work of Bryce Harper over the last bunch of years, it's right up there. So I think he's finally getting his just reward. He is a phenomenal athlete. He's coming through in the clutch in a way that we haven't seen in a long time in the playoffs. And I don't think his recovery at this stage of the game, 160 days, is it? Something like that, that it's that surprising, especially with the newer things that we do now when we do these reconstructions, both on the elbow, the Achilles, elsewhere. We tend to use assistive stents in these surgeries. We're not just using the native tissue, we're also using a prosthetic device to strengthen the reconstructed ligament somewhat. That gives it some quicker short term strength, so allows for maybe pushing the envelope a little bit on getting these people back to their regular activity. So I think that Bryce Harper's return doesn't really surprise me that much, although I applaud it and I'm in awe of it. I mean, hitting a home run on your birthday, really? That's kind of cool.
And I would say one of the best home run celebrations too, blowing out 31 candles while he was standing at home plate. So let's compare that to Aaron Rodgers and his timeline. He's, again, like I mentioned, he's already throwing a ball on a football field. He's trying to get rid of crutches. He doesn't want to be seen basically having a typical recovery. We were all expecting him to miss the season. Now the Jets, 3-3, who are still hoping for a postseason spot, are also hoping to have Aaron Rodgers back for the final weeks of the season and maybe a postseason run.
This one I'm not quite as enthusiastic about. Okay. First of all, when Aaron had this occur, nobody thought the Jets had a snowball's chance in heck to make the playoffs, right? They thought the season was over. And here we are sitting after 6 weeks with the Jets at 3-3. Granted, the Buffalo Bills are obviously the strength in that division, as are the Miami Dolphins. I mean, they're in a tough division. Um, but I think that 3-3 doesn't necessarily mean the Jets are going to be in the playoffs. I think that we have to keep that in mind. Number one. Number two, Aaron Rodgers is a little bit of a different duck. Aaron Rodgers kind of thinks that it's really cool to be seen on the sideline without your boot on, throwing a couple of easy passes, moving around a little bit, no crutches, which again, like I said with the Tommy John procedure of Bryce Harper's, we currently use often a stent in the reconstructed Achilles tendon to give it a little bit more short term strength and aid the speed to getting back to walking without the boot on and doing certain activities of daily living. Activities of daily living is not being a quarterback in the NFL. Even though Aaron Rodgers was never the most mobile of quarterbacks on a good day, I think we're going to see him even less mobile than before when he comes back. But you know what? Tom Brady did a pretty good job being pretty unmobile, right? Let's clear the air on that one. But there's still the danger of being in the pocket and these 280 and 300-pound guys are coming at you and land on you or take you down. That if that Achilles tendon isn't pretty close to back to its normal level of strength, so in other words, it might be strong enough to let you jog a little bit and run a little bit and throw a ball a little bit, but maybe not be taken down by a 300-pound defensive lineman. So I really think that Aaron Rodgers is tempting the odds a little bit by saying that he's going to be back by December or January. A rule of thumb that we often use in rehabilitation is that for every week that a muscle is shut down, it takes 3 weeks for it to come back. So if you immobilize somebody for, say, a month in a boot, so their calf atrophies somewhat, it's going to take 3 months for that calf to come back to where it was once they're out of the boot. Now,
Wow.
again, going back to what I said at the opening of this segment, believe me, they were taking Aaron Rodgers out of his boot and doing calf pumps and exercises even in the first few weeks after his surgery. That was his job. He had trainers and he had physical therapists doing that with him. But he's still going to take a while to get back to normal strength and endurance in his calf. And indeed, the tissues that were repaired need some time to heal and vascularize and be as strong as an uninjured Achilles tendon. I Personal opinion, I haven't examined Aaron. I haven't seen what quality of repair he had, but I have to say that I think him playing in an NFL game in December or January is a very, very big risk.
Wow. So, Dr. Beyer, these super athletes, like we've talked about, have had super recoveries. From your experience as the board certified orthopedic surgeon at Hoag Orthopedic Institute, Dr. Beyer, have you seen the average Joe usually return ahead of timeline?
So I usually talk him out of it. I mean, I'm not going to want to put my surgical procedure at risk for a high school or a college kid who maybe has potential, but potential is not the same thing as having a signed $40 million contract in your back pocket. So I am very, very conservative, especially in younger folk, at the high school and college level, with rushing them to get back to their sport after I've done something to surgically repair them. I I'll just always tell them I'm worried about you 30 years from now, not just right now. So you've got to keep that in mind. I mean, you're my patient 30 years from now too. And if your ankle or your elbow or your knee turns to mush because you started doing stuff before I really thought it was the right thing for you to do, you're going to ruin my outcome and that's not going to make me very happy.
No, I think it is better to be safe than sorry, Dr. Beyer. Great chat talking about Aaron Rodgers, Jalen Ramsey, Bryce Harper. Again, various spectrums of the whole sports continuum. So to be able to think about not just the injuries, but the recovery process and how we can relate to it as the average Joes. Dr. Beyer, thank you so much for the insight.
Carlo, always a pleasure. Look forward to talking to you again soon. Listen for us at 12 noon on AM 830 KLAA, Doctor in the Dugout. We're there every Saturday at 12 noon.